how do we utilize these scarce resources? It's not going to be the best decision if physicians make that decision. It's not going to be the best decision if administrators make that decision. We really need teams of physician leaders and administrators working within a system or a region to figure out how we want to best utilize these scarce resources.
The other thing I think about Anders is that he's such a broad thinker. We're always talking about different things, so he's not just that medical doctor who's just like dialed in on solving a particular problem that walks into the office or that comes across the desk. He's really about the whole person. He's about thinking holistically. He's always there to think with the, challenge the tough topics. And I think that stretches to a broader world where he's really trying to use his skills to help people individually and collectively.
I think he started out life as a beer drinker, and when he realized Sally was a wine drinker, he became a wine enthusiast and knows more about wine now than I do.
Well, he is Scandinavian, so it's all relative.
He's Danish. He's not Norwegian.
This is our hospital, and I've said many times, I'm just 1 heartbeat or 1 step away from meeting.
They do the heads and tails thing?
My hospital.
They did?
He's a great cyclist.
We had these things on it, we didn't do it?
I would see him in that bike pack as being an individual that could usually take the lead. But we're probably choosing not to because he wants to be back, making sure that you've got enough water, pull out a candy bar or two, hand it to you, so make sure that you've got something that you want. And if you're slowing down, probably pull in front of you and take a breath for a while.
Dr. Knutzen has verbal anesthesia. He's able to talk to his patients and make them feel calm without even using any vocal anesthesia.
Conscious sedation, which is a medication in the vein.
Dr. Knutzen radiates that people are first, that the patient ultimately is what later for. He makes you want to work with him just because of his demeanor. He's always prepared. He carries a briefcase with him. It's full of documents that go back 10 years. And it's because he's not trying to put it on the table and show you what you don't know. He's there to pull it out and fill in the blanks and help you understand it when he recognizes that there's some information that can help you see the whole picture of where it's been and where it needs to go. And you don't find that in people unless they really care.
GFR is 42. Yeah. So we need to skip going.
Okay, sounds good.
Okay, thank you.
Bye.
If a clinician comes down and has a question about their patient, he will stop everything he's doing, despite the fact that it is a very busy day, and give them all the time they need to get their question answered.
Well, one more time for me.
Any radiologist has to know the body inside and out, how it works, how it functions. And then as far as what pathology looks like, they have to be able to identify if something is just slightly abnormal and might even just make a little bit of a difference on an image. They have to look into that and figure out why is this patient here? What is the problem that they need to fix?
The other part of that,
Just as a physician and as a radiologist, he is superb. Does his basic job exceedingly well, but he's always available for consultation. Incredibly valuable to me as a pulmonologist to have radiologists who has an interest in chest diseases to be my partner in patient care.
There's a very rewarding component of serving the patient, accomplishing the biopsy, finishing the scan, consulting with the physician in the case, making sure that that individual care is the correct care. Either at file documentation, on the administrative level, there's a satisfaction of being a part of improving the care that the patient and the larger community receives. So I've been blessed to work with a number of my colleagues as medical directors and all the things that we work on. And those physicians together with our administrative colleagues are building a system to encourage to improve the care at United and in these people.
Always knows where he's going, and it fits the attention to detail thing, right? I mean, he knows where we're going, he's a good planner, but at the same time he's that high strung, he's can be super relaxing. So we're painting this picture of this guy that's like technical, but he is really, he can have a good time and relax, and it's great to see him kind of away from the structure.
this is really where our quality
Anders has been a leader from the day he got here. Just look at his desk. my desk may be really messy, I may have some papers here, papers there. Honors is pretty well organized.
Having been in healthcare for many, many years, and being an individual like Honors, it's really clear that not only is he passionate about
We're like two newest therapists.
he also looks at balance. And so we talk often about bicycle riding and things that we do, how to work in order to have find that as leaders. Very complex, very fast-moving environment. I believe that Honors has chosen to work to live, not to live to work.
First of all, I'd like to thank the Hospital Foundation for this honor. I'd like to thank Sally and daughter Kristen for all their patients. I'd like to thank my parents and my group central radiologist for all the parties united who covered for me while I was on the phone or switched their schedule. So I could attend the meeting. I really feel like we were sharing this honor together. So thank you all. And last, I'd like to thank everyone for coming, especially people from St. Radiology and Hospital Medical Department